So my name is Antwi Akom. I am a professor at UCSF at the medical school and at San Francisco State University in the only college of ethnic studies in the United States of America. I'm here today to talk to you about Streetwyze and how community-driven technology can transform the social determinants of health. So I want to start with this idea that we can't really talk about health equity without talking about race-making and place-making and their impact and the way that they intersect together. And the real challenge of the 21st century is how do we redesign and reimagine our cities for communities that have been locked out of sustainability conversations, locked out of shareable city conversations, locked out of smart cities conversations, and locked out of social justice conversations. Will we redesign our cities for rich people or for poor people? For people of color or for white folks? For eco-haves or eco-have-nots? And who will have a say in how we redesign our cities? Powerful elites or everyday people? If we want to create these healthtopias, if we want to build these healthy communities, not for the 1%, but with the 100%, it's not enough to ask, how can we build healthier communities? It's not enough to ask, how can we build happier communities? It's not enough to ask, how can we build greener communities? Without first addressing the real structural inequalities in terms of race, class, gender, immigration, poverty, sexual orientation, and other forms, ability, disabledness and differently abledness, and other forms of social inequality that are impacting the design of our cities, past, present, and future. So from our perspective, we have not correctly identified the problem. We think the CDC and HUD and the EPA and the US Green Building Council, hospitals, big data providers, healthcare providers, on the left-hand side, many of them have done a brilliant job of setting top-down ambitious goals for the design of the built environment. We refer to that as the hardware. But what we think has been missing from this conversation is really what you all know and what I experience every day when we walk through communities, which is our lived experience, the power of place, what's happening on the ground level. And so the real challenge of the 21st century health data revolution then is, how do you bridge this gap between official knowledge, which is the hardware, and local knowledge, which is the software, in ways that make the data more valid and reliable, authentic and meaningful from the perspective of everyday people. And our way of doing this is, and we think the missing link is equity, or what we refer to as people-powered placemaking, which is real-time, two-way communication with everyday people so that they can participate in the design solutions that meet their everyday needs. Our way of achieving that is by building a platform called Streetwyze. And what Streetwyze does is it lifts up the power of local knowledge. Streetwyze is a mobile, mapping, and SMS platform that collects real-time information about how people are experiencing cities and services. And it turns that into actionable analytics. So what that means is right now we have really high-quality geospatial information that Wendy, our amazing moderator, lives near a park, for example. That's great. We know that she lives near a park. She lives near the park that Bon just showed us where the kids play. But what we really want to know is, what is Wendy's experience in that park? Is that the park where the drugs are sold? Is it safe enough for Wendy to bring her children to that park? Do the swing sets even work at that park? What Streetwyze does is it allows you to collect both that proximal data and that experiential data. And you can toggle between the two as you wish. And in doing so, we're able to address these two key questions, which are how do you democratize data and how do you democratize decision-making for our nation's most vulnerable populations? We are partnering with enterprise community partners, which in about 3 weeks, Enterprise is launching a Communities of Opportunity Index that's looking at the relationship between health and housing. And of course, all of you know that Enterprise Community Partners is the largest nonprofit affordable housing provider in the country. Their Opportunity Index will be powered in part by Streetwyze. We're helping to provide them with real-time data on housing. We're helping them build out an evidence-based assessment framework. We're helping them make it open source and easy for folks to use, and we're helping them build a community engagement and partnership toolkit. Streetwyze answers these kinds of questions that are happening beneath the regulatory radar that are about the social determinants of health. For example, how walkable is my neighborhood? Right now, if we wanted to answer the question about how walkable a neighborhood was, we might look to WalkScore. WalkScore is a fine platform, but WalkScore doesn't differentiate between different kinds of amenities like liquor stores and grocery stores. So you can be living in a food desert or a food swamp and have a very high WalkScore. Or WalkScore doesn't say that Bond, myself, and Matt might feel fine walking down that alley in Philadelphia or in some other urban city in the United States, but women would never walk down that alley because that's where women are catcalled. Where is that kind of data being picked up in a systematic way? Streetwyze begins to address these kinds of questions around the social determinants of health. Here's an example of Streetwyze in action. What you're looking at is the publicly available data set for the number of supposed grocery stores that are in East Oakland. This is what the mayor would see. This is what doctors would see. And as you can see, clearly, East Oakland is a veritable food oasis, right? But when you ground truth that data with Streetwyze, what you find out is that most of those supposed grocery stores aren't grocery stores. They're liquor stores. They're corner stores. And only a handful of those are actual real grocery stores. You can also upload pictures and audio and video and integrate with any form of social media. This is critical, too, if you want to address low literacy populations. And our platform is also multilingual in over 4 or 5 languages. So right now, we're going to play a quick video of a young woman. This is the 1.0 version. We can show you the 3.0 version if you're interested. But this is the 1.0 version of a young woman navigating her food environment.
Okay, so what are you, let's see, what are you looking at? How was it when you went inside?
It was dirty when I went inside, and I would never eat anything in there.
Do you consider this to be a grocery store?
Hell no. Because they don't sell any groceries, and it's just a bunch of junk food in there. And I mean, they have little sandwiches, but I would never eat that because it's dirty. And then all the fruit is all old, wrinkly and looks old. And then all the meat that they did have, like the bacon and all that in the little thing, looks like it's been sitting in there for about a year or something like that. I wouldn't call it a grocery store at all. So, hell no, I wouldn't eat there.
So right away, for those of you who have never visited East Oakland, you get a real sense of the food environment in relationship and from the position of the people who actually live there. And this is important because we need to find ways where doctors and clinicians can have information about the social determinants of health in real time before the patients even show up, right? That's making medicine much more efficient and effective for the very people that we're trying to serve. So Streetwyze has been recognized by the Atlantic City Lab is one of the top 12 new data platforms to help vulnerable populations. There's a powerful article in Green Biz about Streetwyze that discusses the platform as one of the few platforms that measures different kinds of resiliency: social resiliency, cultural resiliency, built environment resiliency, and climate resiliency. We were invited by President Obama to the Frontiers Conference, which brought together the top innovators in the world. We were invited for local data, and that's a picture of myself and the co-founder of Streetwyze, who's just amazingly talented and brilliant, Ekta Shah, who will be joining us in a minute, standing next to the former chief data scientist, DJ Patel. And in the bottom right-hand corner, DJ Patel has written Streetwyze a handwritten note, which are hard to get these days, thanking Streetwyze for everything we're doing to make cities work for 100% of the people. We have some really amazing partnerships. We collaborated this summer with Google and Aklama. We used Google Street View cars to collect air quality data. Aklama is leading this charge. They're an amazing startup doing really innovative work. They drive through neighborhoods collecting data on black carbon, on PM 2.5, on NOx and OX. And Streetwyze partnered with them to ground truth that data and identify the hotspots. We're also in conversation with Health Leads, another national network about really connecting the social determinants of health to patients and providers with real-time data. And Find Connect with UCSF is another platform that we'd like to lift up. Please join us in building a new people-centered revolution, a patient-centered revolution, a participatory health revolution that begins to institutionalize health equity into the built environment by integrating local knowledge and official knowledge so that our nation's most vulnerable populations don't have to leave their communities in order to live, learn, work, and thrive. Thank you.